Wernicke-Korsakoff syndrome. Christian Knesselingam, Haleen Alam, Tony Liu, Pooja Modi. PHM 142 Fall 2014. Instructor, Dr. Jeffrey Henderson. In this presentation, background information causes symptoms. Biological significance of thiamine. Relevant pathways. Diagnosis. Treatment. Testing. Background also known as wet brain. Combination of two diseases, Wernicke's encephalopathy and Korsakoff syndrome. Very close relationship. Begins with Wernicke's encephalopathy, if not properly treated quickly, lead to Korsakoff syndrome. Encephalopathy causes alcohol abuse/chronic alcoholism, main cause. Thiamine, vitamin B1, deficiency, secondary cause to alcoholism. Malnutrition caused by dietary restriction or eating disorder. Surgeries related to obesity including bariatric surgery and gastric bypass surgery. Symptoms: anterograde amnesia, inability to form new memories. Memory loss. Loss of muscle coordination. Vision changes such as eyelid drooping, abnormal eye movements, double vision. Hallucination/confusion. Wernicke's encephalopathy. Damage to central nervous system tissue. Characterized by paralysis of the eye muscles, lack of muscle coordination, and confusion. Various other effects occur depending on the area of the lesion: hypothalamus, temperature regulation, medulla, ataxia, Korsakoff syndrome. Characterized by amnesia, creation of new memories, apathy. Both of these diseases are caused by vitamin B1, thiamine, deficiencies. Simultaneous occurrence makes Wernicke-Korsakoff disorder. Biological significance of thiamine. Convert carbohydrates into glucose, sugar, for energy, important for intense physical activity. Breakdown of fats and proteins, aka vitamin B1, B-complex vitamins maintain muscle tone along the walls of digestive tract. Promotes the health of the nervous system, skin, hair, eyes, mouth and liver. Anti-stress, relevant pathways. Transketolase requires thiamine as a cofactor defense against oxidative stress. NADP is crucial in the elimination of H2O2. NADP plays an important role in the synthesis of glutathione, a compound that is essential in the body's defense against oxidative stress. To function properly, all cells require certain levels of NADP and ribose 5-phosphate, and the biochemical reaction mediated by transketolase is crucial for maintaining the appropriate levels of both molecules. With lowered levels of thiamine, the body cannot get rid of hydrogen peroxide properly, leading to cell damage or death from oxidative stress. Relevant pathways: pyruvate dehydrogenase uses thiamine as a cofactor. Pyruvate acetyl-CoA after glycolysis. Also necessary for the citric acid cycle, alpha-ketoglutarate dehydrogenase needs thiamine as a cofactor to catalyze alpha-ketoglutarate 6-enol-CoA. Important for myelin synthesis and neurotransmitter regulation. In general, thiamine is extremely important for energy production in the body. Acetyl-CoA plays a role in myelin formations, so proper functioning of PDH is essential for the synthesis of myelin, which forms an integral part of the neuron sheath, thereby supporting the conduction of action potentials along the axon in synaptic transmission. So in this disorder, we have a buildup of pyruvate and not enough acetyl-CoA, leading to myelin damage and central nervous system damage symptoms. The citric acid cycle and alpha-KGDH should also play a role in maintaining the levels of the neurotransmitters glutamate, gamma-aminobutyric acid, GABA, and aspartate, as well as in protein synthesis. Mechanisms of thiamine deficiency induce cell damage in the central nervous system. The changes in carbohydrate metabolism, i.e. reduction in alpha-KGDH, alpha-ketoglutarate dehydrogenase, activity, can lead to damage to the mitochondria. Because the mitochondria make most of the energy required for cellular function, the damage can result in cell death. Relevant pathways. Diagnosis: WKS is often missed as a diagnosis. Acute phase physical examination. Nutritional testing should be done. Full medical history necessary. Diagnostic imaging may help. WKS is often missed as a diagnosis. In the acute phase, a physical examination may reveal skin changes and a red beefy tongue. In addition, blood count, electrolytes and liver function tests should be conducted. Even in the chronic phase, an MRI may show shrunken mammillary bodies and other changes in the brain. CT scans have showed enlarged ventricles and diencephalic lesions. In cases of suspected non-alcohol-related WKS, the physician may investigate anorexia nervosa, hyperemesis gravidarum, severe malnutrition and other disorders or surgical procedures which impair intestinal absorption of thiamine. Testing for the syndrome. Several simple examinations can be performed, most of which are the nervous/muscular systems and are used to check the damage done to the nerve system. Abnormal eye movement. Decreased or abnormal reflexes. Fast pulse. Low blood pressure. Low body temperature. Muscle weakness and atrophy. Problems with walking, gait, coordination and balance, ataxia. Skin changes. Red beefy tongue. Poor eating habits or eating disorders. Drowsiness or confusion. Skin changes, reddening or jaundice. Eating disorders, anorexia. Testing for the syndrome. There are multiple nutritional tests that may be done. A few of them are: serum albumin equals low. LFTs. Serum vitamin B1 tests equals low. Transketolase, enzyme, activity in the RBCs equals low. Pyruvate levels testing equals high. Serum of urine alcohol level testing. Diagnostic imaging tests for WKS include electrocardiograph, ECG, computed tomography, CT, magnetic resonance imaging, MRI. Recently there has been a testing discovery of genetic marker AB4 which is being used for WKS. Serum albumin test: low levels may signal nutritional deficiencies as well as kidney or liver problems. Transketolase, enzyme, activity in the red blood cells: low enzyme activity signals a vitamin B1 deficiency. Pyruvate equals high. If the history is significant for chronic, long-term, alcohol abuse, serum or urine alcohol levels may be elevated. Electrocardiograph, ECG, which looks for abnormalities before and after giving vitamin B1. Computed tomography, CT, scan to check for brain lesions related to WD. Magnetic resonance imaging, MRI, scan to look for brain changes related to WD. Physicians may also use neuropsychological tests to judge the severity of mental deficiencies. It is a significant predictor of global intellectual deficits in people with WKS. Individuals with the APT genotype may experience a certain interaction with heavy alcohol use which could predispose them to WKS. Concerns about an inherited susceptibility to WKS should be discussed with a genetic counselor. Treatment. WKS treatment should begin immediately and initially treatment may involve hospitalization. There are 3 types. Nutritional. Balanced diet with vitamin B1. Medicational. Intravenous vitamin B1. Oral vitamin B1. In some cases treatment of vitamin B1 deficiency and adverse reaction may occur. Psychological/social. Alcoholism, withdrawal symptoms, quitting. Brain damage. WKS treatment should begin immediately. Prompt treatment may delay or stop disease progression. Treatments are also able to reverse non-permanent brain abnormalities. Treatment may first involve hospitalization. At the hospital, the patient will be monitored to ensure that his or her digestive system is absorbing food properly. The doctor may also administer vitamin B1 to the patient through and for. Treatment for WKS may include intravenous vitamin B1 given through and for an arm or hand. Oral vitamin B1 for continued maintenance after initial treatment. Balanced diet, to keep vitamin B1 levels up. Treatment for alcoholism, help with withdrawal, support in quitting, etc. In a small number of cases, treatment with vitamin B1 deficiency produces a negative reaction. This is more common in alcoholics. Negative reactions to receiving vitamin B1 may vary. Reactions may include alcohol withdrawal symptoms like insomnia, sweating, or mood swings. The patient may also experience hallucinations, confusion, and/or agitation. Summary slide. This illness is a combination of Wernicke's encephalopathy and Korsakoff syndrome. Number 1 cause, alcohol abuse/chronic alcoholism. Thiamine deficiency is also a major cause. Common symptoms: confusion, loss of memories, loss of muscle coordination, hallucinations and vision problems. A diagnosis involves physical examinations and nutritional testing. Medical history and diagnostic imaging may be used additionally. Treatment involves having a balanced diet, taking vitamin B1 supplements and receiving psychological aid where necessary. Thiamine is important for converting carbohydrates into glucose, sugar, for energy, breakdown of fats and proteins, maintaining muscle tone along the walls of digestive tract, promoting the health of the nervous system, skin, hair, eyes, mouth and liver. Thiamine is needed as a cofactor of the transketolase to make NAD for maintenance of oxidative stress. Pyruvate dehydrogenase uses thiamine as a cofactor to make acetyl-CoA after glycolysis. Alpha-ketoglutarate dehydrogenase needs thiamine as a cofactor to create succinyl-CoA from alpha-ketoglutarate in the citric acid cycle.